on a pull-down menu, I've got a list right here. So this is an example right here of our location finder. And I highlight the hospital. Within the hospital, so we'll look at Logan Regional Hospital here. And this is the newborn, and then I'm not going to connect to a live patient room in here, but I know what room the patient's in off the medical record, and I double-click that and initiate a call. When that happens, in the room, there's a high-quality camera, and this camera allows us to pan back and see the whole room, and it also allows us to focus in so that we can literally read the gradations on our finest syringes or examine the patient's pupils. In the room, what they see is me largely filling the screen and a little picture-in-picture over here of what I'm looking at in the room, and then conversely, I've got a 6-monitor workstation. On one of those monitors, I see them filling the screen, and a little picture-in-picture of me to remind myself of where it is that I'm looking. And one of the things that can poison the interaction is if you seem to be distracted. So for instance, if I'm looking at them and their image is not near the camera, to them it looks like I'm looking off in space. And so we do have to train a little bit about how do you present yourself in the room so that they know you're paying attention to them and not looking elsewhere.
So it leverages the power of Skype for Business?
Yes, exactly. Yep. It's Skype for Business. It's simple, intuitive, user-friendly, and highly reliable.
So how does the patient see this?
We've had very good acceptance from patients on this. They don't initiate within our program. They're not the ones that initiate a call. It can be a caregiver in their room who initiates the call. But we have found that their acceptance, the level of acceptance and trust using this tool has been very high.
So does it eliminate like the need for other, because he was telling me about the need for these carts.
Yes.
So it puts all the carts in one, this cart right here.
Yeah, so as an example, we have these installations, like this camera up there, we're approaching 1,000 endpoints that have this installation done, but we have, in our system, we have more than 1,000 beds. And so we've hit the most likely areas to interact, but these mobile carts allow us to get into those areas that are not yet installed. So a hospital could have 1 or 2 of these carts, and they can be wheeled into the room at a time of crisis. As an example, there's something called a rapid response, where a patient is suddenly deteriorating. They're not in an intensive care unit. They're in a regular hospital floor bed, and the nurse wants to summon help. In several of our hospitals now, we're working and planning to expand this, where they can, when they go into the room, they bring this with them, and now they have us as an additional team member interacting. And for us, it's seamless. Whether I'm interacting with this mobile cart or the pre-installed camera, it's the same for me. I still use the same process to double-click and to initiate the call. I have the same process for aiming the camera around and for interacting.
So would you say that it transforms the way you do healthcare?
It is. It is definitely transforming the way we do healthcare. Again, we are improving the access to care. Probably 15% of the population in our service area lives a long distance away from advanced medical care, and so we can give those 15% much of the same access that people have who live close to advanced care. And we are continuing to expand in that direction. There are hospitals outside of Intermountain Healthcare that increasingly want to and are joining our network. So we're transforming care through access, we're transforming care through safety, we're an extra layer of support to help prevent, it's a very high-risk environment, and we want to prevent any medical error from reaching the patient, so we become doctor, nurse, couple extra layers of support for the patient, and at the same time we're transforming care by reducing costs. And there's several ways that we do that.
Microsoft's mission is to empower people. How does the Skype for Business technology empower you?
It empowers me to reach patients far earlier in the course of their illness than I otherwise could. So what I tell my team that we're trying to do is to engage critical illness and injury when and where it occurs. And it turns out that, and shouldn't be surprising, that if somebody is deteriorating, the longer it takes for the right things to happen, the less likely they are to recover. The longer their recovery will take, and the more expensive their recovery will be. So this empowers my team to get early on so we can turn off a lot of these problems by prompt attention so they don't turn into a big complicated thing.
So moving forward, would you say that this technology can help solve like illnesses like cancer and other stuff?
I don't, right now our cancer folks will be increasingly using this to help, again, provide highly personalized and advanced cancer care, and they already are doing some of that, to people in remote areas. So I don't see yet how Skype for Business, I wouldn't say it's transforming cancer care as much as it's taking the same kind of cancer care and assuring that that same high quality is accessible far more broadly.
So it's more for like neonatal care and children
care. And adults
and babies.
Yeah, children, neonates are definitely part of this program, and it is transforming their care. And I'll have to say that I'm a critical care specialist, so it's easier for me to see how this transformation is going to happen in my specialty than in someone else's specialty. But it's absolutely transforming the care there because of the rapid access. And the ability to add that extra layer of support to help prevent medical errors.
All right, thank you so much for your time.
Okay, sure.
Thank you, doctor.
Yeah, sure, thanks for your interest.